Good morning, everybody. Thank you so much for joining us today. My name is Carrie McClellan. I'm the Outreach Manager for ElderHelp, and I am so honored to be here with Dr. Kim Bell, who I will introduce to you in a moment. We're very excited about sharing this topic, dizziness and vertigo, because so many of us, as well as people that we know, are dealing with this every single day. And I'm really excited to be able to share information from an expert, and hopefully it will help all of you. Before we get started in that, though, I do want to ask that everybody mutes their microphones so that we don't have any background noise. And we will open up for questions at the end of the presentation. So if you do have any questions, you would use the chat function to submit those, and we will open that up when we are done with the presentation. So thank you so much. Just a few things about ElderHelp before we get started and why we do these webinars. So ElderHelp, we're a local nonprofit organization here in San Diego, and we support seniors and their independence by helping them to continue living at home. We have been around for over 45 years, and throughout that time, we have helped over 221,000 seniors and their families try and figure out what resources are available so that they are able to stay independent at home and live successfully. We have realized that over time, we have received so many different calls from family members who are looking for help for their loved ones. So we have created these webinars as a tool to be able to reach out to those individuals and offer a variety of topics to help support them through their journey as they are caring for aging loved ones. This topic is important for anybody, whether a family caregiver, whether a community member, a volunteer, or a provider. So we are excited to share this topic with those in the community who could benefit from learning more. And all of our services through ElderHelp are really geared at reducing social isolation, increasing access to healthcare, and improving overall quality of life for older adults. So I'm going to introduce you now to Dr. Kim Bell. She has a doctorate degree and a master's degree in physical therapy. She is an expert in fall prevention, balance problems, dizziness, and vertigo. She is the founder and CEO of Kim Bell Physical Therapy, with a team of vestibular expert physical therapists who make house calls all over San Diego County for private patients with dizziness, vertigo, unsteadiness, and falls. Dr. Bell offers a free 15-minute phone consultation to anyone who calls her with one or more of those problems. And Kim Bell is also a singer and songwriter who is currently recording an original music album. So she obviously has many talents, and we're so excited to have her here with us today. So welcome.
Thank you so much, Carrie. I want to say hi to everybody who's out there listening right now. I really appreciate your time and tuning in for this topic that tends to be irrelevant to people's lives until all of a sudden it becomes an emergency. And so it's great that you're learning about this now, whether or not you have vertigo or dizziness, whether or not you know somebody who does at this time, because chances are at some point you will meet somebody that has one of these complaints, and it would be great for you to be a resource for that person. So this talk I've designed to address the caregiver's perspective of dizziness and vertigo. So what is the role of a caregiver when somebody has dizziness and vertigo? And the caregiver, as Carrie mentioned, might be a paid caregiver, a provider. It might be a volunteer caregiver, or it might be a family caregiver. And so I'll be addressing this topic, dizziness and vertigo, from that perspective. My personal mission and the mission of my business, Kim Bell Physical Therapy, is to rescue mismanaged and misunderstood people with dizziness, vertigo, imbalance, and chronic falls. The learning objectives for today's webinar are these 5 things. This will be the only slide where you'll see me read the text, just to make sure we're on the same page with the objectives for today. So the first one is to differentiate between dizziness and vertigo. The second objective is learn how to track and report symptoms. The third objective is for you to understand how to manage an episode of dizziness or vertigo that occurs when lying down or rolling over in bed. The fourth objective is to learn how to manage an episode of dizziness or vertigo that occurs upon standing. And the fifth objective is to understand when to seek medical care and how to find a provider. So in order to make sure that we're on the same page, I'm going to start off discussing terminology. The first thing I want to establish is that when I'm talking about the person that you are a caregiver for, I may use the terms loved one or client interchangeably as I'm talking. Just want to make sure you're aware of that. In terms of the terminology for the topic today, dizziness is sort of the catch-all phrase that people typically use for three different things: dizziness, vertigo, and disequilibrium. All of those three symptoms are typically referred to by the general public under the umbrella of dizziness. And so dizziness is a symptom. It is not a root cause. And dizziness indicates that an investigation needs to be undertaken as to the root cause. So typically when we look at dizziness, vertigo, and disequilibrium, I'm going to provide you with more of the medical definition so that you can distinguish between the three. But please understand that most people in the general public use the term dizziness for all three. Dizziness, in terms of medical terminology, refers to a feeling of lightheadedness, almost like as if you're about to pass out. Like you think of the cartoons where you see little birdies or little stars swirling around a cartoon's head. That feeling of I'm lightheaded, I feel maybe a little foggy, I feel like I could pass out if this gets any worse. That's typically what we mean when we talk about dizziness in the medical profession. The term vertigo is distinguished from dizziness by an involvement of motion. So vertigo can either be a perception of spinning, tilting, or sliding when you're actually not moving at all, or vertigo can be a distortion of otherwise normal motion. So an example would be if you roll over in your bed and you stop on your side, and so you're not actually moving anymore, but you feel as if you're rolling in a barrel down a hill. That's an example of vertigo because you feel like you're spinning and rolling, but you're actually still. Another example of vertigo would be if you feel like you're walking straight, but when I look at you walking, you're actually walking off to the right. That's an example of vertigo because it's a distorted perception of motion. Both of those things would be considered vertigo. And then the third thing that falls under the general umbrella of dizziness is what we call disequilibrium. Equilibrium is a feeling of being balanced. It's a feeling that you're stable, that you're not going to tip over to the side, whether you're sitting up or standing up or walking. And so it's a feeling of being centered where your body weight is equally lined up within your feet while you're standing. That's equilibrium. So disequilibrium is not feeling that way. It's feeling like you might tip over forward, or you might tip over backwards, or you might tip over to the side. You don't feel centered and stable, whether you're sitting or standing or walking. So that's called disequilibrium. And some people have only one of these problems. Some people only have dizziness, they only have vertigo, or they only have disequilibrium. Some people have two of those problems, and some people have all three. Many people have different ones at different times of day. For example, they might feel a vertigo spin when they roll over in bed, but then throughout the rest of the day, they feel disequilibrium or general feeling of dizziness. So these symptoms kind of overlap, and they can occur in different arrangements for different people. So to address the objective of when to seek medical care, the first thing I want to mention is that sometimes dizziness and vertigo can indicate a medical emergency. So these are the criteria for seeking emergency care with a sudden onset of dizziness or vertigo. If you also have a co-occurring, or if your loved one also has a co-occurring feeling of shortness of breath, chest pain, neck or arm pain or jaw pain, which could indicate a possible heart attack situation. Dizziness can be a symptom of a heart attack. Or if you have a co-occurring onset of double vision, blurry vision, numbness in an arm or leg, difficulty moving an arm or leg, slurred speech, or mental confusion. Those could indicate that the dizziness or vertigo is actually a symptom of a stroke. And for both a heart attack and a stroke, seeking emergency care within the first hour of onset of this cluster of symptoms is important for the best outcome. So those are important considerations. The other times that dizziness or vertigo may require emergency care is if all of a sudden you're suddenly unable to sit up on your own, or your client is suddenly unable to sit up on their own, suddenly unable to stand or walk on their own. For example, the day before they were getting out of their chair, walking to the bathroom, maybe with a walker, and then all of a sudden today they're feeling really dizzy or they're having vertigo and they absolutely cannot sit up on their own, or they cannot stand up or walk on their own, and it's a sudden change in status that coincides with the dizziness or vertigo. That would be a reason to seek emergency medical care. The other thing would be a sudden and complete hearing loss in one of the ears with the onset of dizziness or vertigo, or uncontrolled vomiting. And the reason about the uncontrolled vomiting, if that comes along with the vertigo, is because it's important to get IV fluids and get rehydrated at the emergency room if the vertigo is resulting in uncontrolled vomiting. So those are the reasons that an emergency room trip would be needed. And the final thing I usually say to people is, if you've already been having difficulty with balance and walking, and then you start feeling dizzy or having vertigo, and you feel that these new symptoms will put you at risk for a fall or a fall-related injury, you can always use the emergency room to access a higher level of medical care, maybe to be admitted to the hospital to prevent you from having a devastating fall with these new onset of symptoms. So those are the reasons you might seek emergency room care for dizziness or vertigo. You can call 911 if you feel like you need transport to the emergency room. I've certainly done that for some of my patients that I thought maybe were having a stroke, or you can just walk into the emergency room. Regardless of whether you decide to seek emergency care, you should always report dizziness and vertigo to your primary care doctor. So if you go to the emergency room, they'll tell you to follow up with your doctor when you leave. But even if you don't feel like the dizziness or vertigo is an emergency, you still want to notify your primary care doctor of the dizziness and the vertigo symptoms so that they can do their own investigation of what they think is the root cause, and also make appropriate referrals for other providers to consult on your case or for diagnostic testing. Some of the reasons that it's important to let your doctor know of the dizziness and vertigo is because dizziness and vertigo can contribute to falls, and of course, falls can be life-changing if they cause a serious injury. Dizziness and vertigo also can contribute to anxiety, which interferes with daily functioning by overwhelming thought processes. I've met some people with dizziness and vertigo, and they just are constantly worrying about it, thinking about it, nervous about it, and it sort of overwhelms their day and it interferes with their ability to take care of themselves. If dizziness and vertigo goes on for too long, sometimes it can contribute to depression and even in some cases suicidal thoughts. And that's why it's important to report these symptoms to the primary care doctor. As we get older, we know that normal changes to muscles occur for everybody, where our muscles lose mass and strength just through normal aging of the muscles. And it is important to exercise regularly as we're getting older to prevent the loss of muscle mass and muscle strength. So if dizziness or vertigo is preventing your client's ability to participate in exercise, that's another reason to seek medical care, because exercise is really important for quality of life. And finally, unresolved dizziness or vertigo can just interfere with the fun aspect and the joy of life. And those are all reasons why you would seek medical care. The goal of seeking the medical care is to figure out why these symptoms are happening. And there are many different root causes for dizziness and vertigo and disequilibrium, which is not the focus of the lecture today, the webinar today, but it is important to figure out. And so what I want to make sure you know is that doctors will often give medications to reduce the feelings of dizziness and vertigo, and those medications are very helpful to improve the discomfort that the person is experiencing. However, some of the medications also cause dizziness as a side effect. So unfortunately, they don't always resolve the problem. They may lessen the intensity of the dizziness or vertigo, but they may then also cause dizziness as a side effect. If you look at the information that you get when the medication comes from the pharmacy, dizziness is often listed as a side effect of the most common medications that are given for dizziness and vertigo. So medication is great for improving comfort and reducing symptoms, but ultimately you want to do a further investigation of the root cause, because many people don't need the medication long term if they can figure out the root cause of the problem and resolve it. Now, some people I meet, once the root cause is evaluated, they don't have a good prognosis for recovery for whatever reason, and they do need to take medication long term just to reduce the symptoms, and that's fine. However, I would say that should be decided as the long-term plan after the root cause evaluation is undertaken by healthcare professionals. The goal would be to go over your symptoms with your primary care doctor and any other professionals that the doctor refers you to figure out what the primary problems are and then discover the root cause. There may be one root cause or there may be multiple root causes. And in order to determine that, your role as the caregiver is to really help your client or your loved one track their symptoms. And this is an example just showing a gentleman writing down his symptoms, so you can keep track of the symptoms of dizziness or vertigo in a journal format that you can bring to the doctor. You could also track the symptoms on a laptop, create a document to track the symptoms of dizziness and vertigo, and basically what you're doing is you're being like a data collector, and you're collecting data to present to the doctor and any other healthcare professionals that you consult with, because the more information you give them, the more they can work towards figuring out the root cause. And when you look at the research for dizziness and vertigo, the research is very clear that there's three main pieces of data that healthcare providers need to figure out the root cause of dizziness and vertigo. This speaks to one of our other objectives, which is how to track and report symptoms. The symptoms that your healthcare providers need are to know the onset, the trigger, and the duration of any symptoms. So just to give you an example, I talked to a gentleman this morning who had a sudden onset. He didn't know what the trigger was, but the duration was 12 days. That gives me a lot of information as to what I think is the cause. I spoke to someone else who had an onset of rolling over in bed. So the onset was first thing in the morning when I rolled over. The trigger was assumed to be rolling over in bed, and the duration was about 30 seconds. And that also gives me a lot of data as far as what the root cause might be. So what you want to do is track the onset, the trigger, and the duration for any symptoms of dizziness and vertigo, and have that data to present to the doctor and any other healthcare providers that you see. Along with the symptom onset, trigger, and duration, the other information that is very helpful is to let your doctor know if you've experienced any changes to your hearing, or if your loved one has experienced any changes to their hearing. This could be a gradual reduction in hearing. It could be a reduction in hearing only associated with the dizziness or vertigo that then was restored back to normal after the dizziness or vertigo was resolved. It could be ringing in the ears, roaring in the ears, or sort of background noise in the ears. So that's very helpful to let them know if there's any change in the hearing associated with the dizziness and vertigo. The other thing that's helpful to track is if there's any headache associated with the dizziness or vertigo. So if there's any head pain, throbbing in the head, anything like that that has come on with the dizziness or vertigo, that's very helpful to track and report as well. So I want to say I've already suggested writing down the information in a journal format or typing the information on a laptop or a desktop computer. The other thing you could do is help your loved one or your client track their symptoms using a smartphone. So I worked with a woman a couple weeks ago in her 70s, and she took out her phone during our initial visit, and she pulled up her notes app on her phone, and she went through and she had recorded every episode of vertigo she had with the date, the time, and the duration. And I said that was really helpful. In the future, I coached her that I wanted her to also write down the onset and the trigger so that I had a little bit more information about what preceded that event. But she was very great the way she tracked it with her smartphone. So those are 3 different strategies that you can use to track and report symptoms. And then ultimately, the satisfactory root cause explanation for the symptoms would account for all the episodes of vertigo or dizziness you've experienced from the beginning of the onset. So your job as the caregiver is really to be a coach. In addition to coaching your client or your loved one about how to track and report their symptoms, or helping them track and report their symptoms, you also want to be able to coach them if they get dizzy or have vertigo during certain activities that might happen. So I picked the top 2 because they're the most common that I see, which are dizziness with standing up and then dizziness with lying down and rolling in bed. So this speaks to one of our objectives. If someone feels dizzy when they stand up, this is an example of a gentleman that's feeling dizzy now that he has sat up on the edge of his bed from lying down. So dizziness can occur if you go from lying down to sitting up, or it can occur if you go from sitting to standing. And one of the reasons that happens is because your blood pressure, the blood pressure may not respond appropriately to the pull of gravity. And that results in more of the blood pooling down in the feet and ankles and legs and less blood in the brain, which makes people feel a little dizzy or a little lightheaded. And it can last for 10 seconds, it can last for 30 seconds, it can last for 1 minute, 2 minutes, 5 minutes, or it can last the whole time someone is sitting up with their legs down. So one of the strategies that I teach all my patients that are dizzy when they sit up or they stand is to use the calf pumping action. This particular picture shows somebody lifting both heels at the same time while the feet and toes are on the floor. So that's one strategy. If your client or your loved one is sitting on the edge of their bed or sitting in a chair and they've just gotten up from lying down and they get dizzy, they can put both of their feet on the floor and lift their heels to use that calf pumping action. The calf is the muscle on the back of the lower leg. And if we can get that muscle to pump, it will squeeze the blood back out of the leg up to the trunk and ultimately up to the brain. So you can lift the heels with the toes and feet on the ground. You can lift both heels at the same time, or you can alternate lifting the heels. You could do this, say, 10, 15, 20 times, and basically you want to keep doing it until you're not feeling lightheaded anymore. The other thing you can do is you can actually lift the feet off the ground altogether and just pump the feet up and down. We call that ankle pumps. So in that case, your feet wouldn't be touching the ground. Your feet would be just in the middle of the air, pumping up and down, flexing and pointing the foot and the ankle to pump the calf once again. And then when somebody stands up, if they feel dizzy, one strategy I'd like to teach is to do 10 to 20 calf pumps while they're sitting before they even stand up to prepare for standing, to sort of get that blood moving in advance of standing. And then once they stand, if they still get a little dizzy, they can alternate lifting their heels. So when you're standing, you probably won't lift both heels at the same time because that's too difficult. But you can hold on to a table or a counter or a loved one and alternate lifting your heels in order to pump the calves while you stand up. So I did work with one woman recently who I taught this to, and she had significant knee pain. And so when she stood up, I said, now try alternating, lifting your heels to pump your calves. And she said, oh, that just hurts my knee so much. So I said, okay, then that's not a good idea for you. So this might not be a good idea if you have significant pain in your knee or if you have problems with your balance that could cause you to fall. But certainly this is the strategy we teach for people that get dizzy when they stand up. The other point related to this is then an investigation needs to be undertaken as to why the person is dizzy when they stand. So there's different reasons why people get dizzy when they stand up, and that needs to be determined to see if that problem can be reduced, if not eliminated. The purpose of the calf pumping action is to reduce the length of time that someone feels lightheaded after they get up. Now we're going to move on to dizziness or vertigo that might be felt when somebody lies down or rolls over in bed. Now I have a blog, actually I have 2 blogs, and I have over 100 published articles that I've written on my blogs. And by far, my blog that says, why do I get dizzy when I lie down or roll over in bed, is by far the most popular blog that I have. So this is a really common problem, and we're going to talk about this in a little bit more detail. But basically what happens is people might feel dizzy or they might have a vertigo spin when they lie down at night to go to bed, or when they roll over in the middle of the night, or when they wake up in the morning and get out of bed. So the strategy that we teach for people that are getting dizzy when they lie down or roll over in bed, mostly to avoid that experience, is to prop up on at least 2 pillows. So you can prop up on at least 2 pillows in your bed. Some people opt to sleep in a recliner. So they'll sleep in a recliner with their feet up in order that their head is not all the way down flat on the bed. So typically the symptoms of dizziness or vertigo that people experience when they lie down or roll over in bed are most often experienced when the person is lying all the way flat or they're only on 1 pillow. So in order to avoid that, we teach to prop up on 2 pillows or to sleep in a recliner that reclines back but not all the way. Now, in general, this is a short-term fix because it's not really good for your neck to sleep propped up all the time, and it can cause neck discomfort over time. So this would be sort of a short-term strategy to manage dizziness with lying down or rolling over in bed. And what I want to talk about now is a little bit more information about what causes dizziness lying down or rolling over in bed, mainly because when people experience that, it only lasts usually for less than a minute, so they really disregard it and they feel like, oh, well, I was only dizzy for a few seconds when I rolled over, but it's no big deal. I don't need to do anything about it. But what I want to explain is that the most common cause of the symptoms of dizziness or vertigo when lying down or rolling in bed also affects balance when you're walking around during the day. So when I evaluate people with chronic falls, this particular reason is one of the most common things I see. And that's why I want to make sure that all of you know about it because it can be addressed. So this diagram here is sort of a snapshot of the ear. And you see the ear all the way on the left side here. I'm sorry, the right side if you're facing the screen. Is that right or left, Carrie?
Left.
Okay, the left side. Well, you see the ear there. And then basically this is a cutout where you see the middle ear and then you see the inner ear. The inner ear is the area with what looks like a snail, basically. And that is where your hearing takes place, and that's also where your balance system is coordinated. It's sort of like a gyroscope that responds to the pull of gravity and the pull of forces related to gravity, like centripetal force and centrifugal force, when you're moving around in what's called a gravito-inertial field. So basically when we move, we experience gravitational forces, and that apparatus, the vestibular system, which you see there, is set up to sense our movement in space, okay? Now, if it's working well, that's great, but if it's not working well, it can cause vertigo and dizziness and disequilibrium. So what I'm going to talk about now is the most common cause of vertigo, dizziness, and disequilibrium from the vestibular system, which is the inner ear. And then also, this is the most common cause of dizziness and vertigo when lying down and rolling over in bed. Now, like I said, those symptoms are typically triggered by the motion, and they usually last for less than a minute. So a lot of people disregard them, but they do cause disequilibrium and falls when the person is up and walking around throughout the day. So this is a picture, a diagram provided by the Vestibular Disorders Association. That is a nonprofit international association for both providers and patients that are interested in inner ear problems. So I'm a professional member of this group. And basically this is a close-up of what we just saw. This is a close-up of the vestibular system. And what you see here is you see what's called the utricle. If you look right there in the middle of the diagram, utricle, that is one of the organs of the inner ear vestibular system. It actually senses when we speed up and slow down in a car or on a train. And it has crystals inside of it that are supposed to be there. They help with the sensory goal of telling if you're accelerating or decelerating in a car or on a train. And so they have a purpose and they have a function. But what happens is, guess what? Through normal aging, the crystals come off the membrane where they're supposed to be inside the utricle, and they start floating around in the fluid that connects the utricle to the other three canals that you see. So we have an anterior canal at the top, we have a posterior canal, and we have a horizontal canal. Those are called the semicircular canals of the vestibular system, and they all share fluid with the utricle. What that means is if the crystals in the utricle break off through normal aging, then they can go floating around in any of these canals. Now you see the diagram here shows the crystals in the lower part of the diagram because most often they sink down because of just the pull of gravity. They sink down and they get into the posterior canal. That's where we find the crystals 85% of the time, maybe 90% of the time. If they float into the horizontal canal, then that's where we find them about 10 to 15% of the time, and then they can go up into the anterior canal, but you can see if they start to go up into the anterior canal, typically they just fall back down unless they go up over the top and then they lodge on the other side. And that would happen if somebody gets in like a car accident, or they are doing things like somersaults in the ocean where they're flipping around and upside down, and then the crystals can have enough momentum to get lodged in the anterior canal. That's pretty rare. We see that in only about 2 to 5% of cases. So basically what this is describing to you is what we call the ear crystals. Some people call it rocks in the ears, and the technical term for it is BPPV. B means benign, meaning it's not a disease or a pathology. And I also like to refer to the B as biomechanical, because it's a true biomechanical problem. It's a biological thing that's causing a mechanical problem of crystals out of place. So B, that's the first letter, and then P is paroxysmal. Paroxysmal means basically it's not constant, it comes and goes. And that would be the person has a spin or a feeling of dizziness when they move in certain positions like lying down or rolling over in bed. So it's not a constant feeling. And then positional, in terms of the BPPV definition, the second P is positional, meaning certain positions and certain movements trigger it, and then the V meaning vertigo, which is that false sense of spinning, tilting, or sliding when you're not moving in that direction. So that's BPPV. It's the most common inner ear problem that causes dizziness and vertigo, and it's by far the most common reason people have dizziness and vertigo when they lie down or roll over in bed. So here's the good news about it. even though unfortunately it is part of normal aging of the ear for those crystals to come off, good news is that simple BPPV, meaning only in one canal, can be resolved in 1 to 2 treatment sessions about 85 to 90% of the time. So the way this is actually treated is first the provider will have to determine where the crystals have gone, because they migrate to different areas of those canals as I described, and they can actually be found in multiple canals. I've had people with crystals in all 3 canals in one ear, or maybe all 5 or all 6 canals, including the right ear and the left ear, because each ear has 3 total canals. So the good news is that a single canal can be resolved in 1 to 2 treatment sessions 85 to 90% of the time. So that this particular care, skilled care for BPPV, is considered the most valuable care that's available in modern medicine today. I mean, what else do you really know of that gets such good outcomes in such a short amount of time? And this is why in my business, I only see my patients for an average of 2 to 3 visits, because we get them better quickly and then they move on with their lives. I want to let you know about BPPV. It does have a rate of about 35% recurrence. So what that means is if the person you're caring for or your loved one has had this in the past and they got it treated, that doesn't mean it can't come back, okay? It's about 35% chance it'll come back again, and especially as people are getting older due to normal aging of the ear. Now, if somebody has migraines, migraine headaches, they have a 50% chance of recurrence. So people with migraines are more likely to get BPPV crystals. People without migraines, the rate is 35%. So what I want to do to make sure you're fully informed about BPPV is I want to share with you 2 other common positions that people feel dizzy or have vertigo when they have BPPV, in addition to lying down or rolling over in bed. One of them commonly is when people put in their eye drops. So when people tip their head backwards to put in their eye drops, if they get a little dizzy or they feel a little off balance, even if it's just for a few seconds, that typically might mean they have BPPV, and that could be the root cause of general feelings of disequilibrium or chronic falls, if they also have that. And then the other common time people will get a little bit dizzy or maybe have a spin that lasts for less than a minute is when they go to the dentist and they tip their head back. So I actually talk to a lot of dentists and dental hygienists that tell me certain patients of theirs come in and they're not able to lean back in the chair because they get dizzy, and I say, well, that would be a great person to find a vestibular provider to help resolve that problem, because keep in mind this can be treated in 1 to 2 treatment sessions successfully about 85 to 90% of the time. So as a caregiver, your job is really advocacy, and what that means is taking action steps to move forward to resolve dizziness and vertigo by tracking the symptoms to report to the healthcare providers, and also by coaching your client or loved one in how to manage the symptoms if they experience it at certain times during the day to reduce their discomfort. One of the things that people commonly do when they have problems with balance or they have chronic falls is they go to physical therapy. Physical therapy is actually very successful with improving balance and improving walking. Generally, physical therapists improve the way you move. And you might have consulted a physical therapist at an outpatient clinic, which means you got in the car and drove to the clinic to see them. You might have seen a physical therapist in a home under home health, if the client or loved one is homebound. And then you might have also seen a physical therapist at a hospital or a nursing home or rehab center. So physical therapists are available in different settings based on what people need. One of the things that I hear from people frequently is, I've already worked with a physical therapist and I'm still having problems with balance or falls, or I'm still dizzy or having vertigo. So related to that, I want to let you know that one research study showed that 80% of patients with chronic falls of unknown cause, meaning it wasn't obvious that they just tripped over their dog or something like that, it was an unknown cause of the fall, they had symptoms of vestibular problems, which is the inner ear, when they were tested. What that means is if you know someone who's having chronic falls and they've already gone to physical therapy, general physical therapy, and it didn't really help, maybe they need to see a vestibular provider. The good news related to this is that another research study showed that vestibular rehabilitation, which is the physical therapy specifically for the vestibular system, it can be for dizziness, vertigo, balance problems, or chronic falls, or unstable walking. These exercises were shown in a research study to improve walking and balancing in older adults, even if they didn't have an inner ear problem. So that's important to know, because basically, if you sort of haven't gotten success in traditional physical therapy, the next step would be to go to vestibular physical therapy. It's likely that they could discover the cause of chronic falls. In about 80% of cases, it will be an inner ear problem. And then even if it's not, the exercises that they give will still improve balance and walking. So really your job as a caregiver is to stop the downward spiral. So when people have chronic dizziness or vertigo, it causes confusion, it causes stress, anxiety, depression, social isolation. It can prevent them from exercising, it can prevent them from enjoying life, and it really starts a downward spiral. So that's what I want to caution you, is the risk of not addressing dizziness and vertigo proactively. As a caregiver, you really want to advocate for your client or loved one to have a root cause analysis, which is going to be conducted by a healthcare provider or a team of healthcare providers. And the goal would be to stop the domino effect of having chronic dizziness and vertigo. So if you want to find a vestibular provider, you can look at the website vestibular.org, which is the Vestibular Disorders Association that I already mentioned. They have actually great resources for patients for free on their website. They also have a provider directory. So when I hear from people that are outside the San Diego area, say they live in Michigan or New York or Florida, and they say, who can I find that does what you do? I refer them to this website and I say, look at vestibular.org and find a provider in your area that says they do this kind of work. Now, this website has doctors listed if you need to consult with a specialty doctor, and it also has physical therapists listed. Physical therapists are typically the ones that treat the problems and do exercises and interventions to resolve the issues. The doctors are typically the ones that prescribe medications related to it or order diagnostic testing, and they can also make a referral to physical therapy if you want to use your insurance to pay for the physical therapy. If this topic is of particular interest to you, I want to let you know that I have 3 public lectures on UCTV that I did at UCSD Stein Public Lecture Series. 1 lecture is on fall prevention, and then I have 2 lectures on dizziness and vertigo. Dizziness and vertigo part 1, which is more of a panel discussion, and then I have dizziness and vertigo part 2, where I get into a lot of detail about root cause analysis and how to figure out what the cause of the dizziness and vertigo is. These lectures have over 500,000 views total on UCTV, and people have called me from all over the country actually saying that the lectures were very helpful. I just heard from a woman in the state of Virginia that said, wow, that lecture was epic. It was exactly what I needed, and now I know exactly what to do for myself. So she just gave me a call to let me know it was helpful, and that would be a place to go for more information if you want to check that out. And the goal, of course, of the webinar and the talk today is to really improve the quality of life so that dizziness and vertigo does not become a chronic problem that goes unresolved and unaddressed, and to make sure the quality of life is good right up until the end. So I hope this was helpful. I'm going to turn it over to Carrie now to discuss any questions that we've received.
Sure, great. Thank you so much. I always learn more when I listen to you. So I'm sure that our viewers are feeling the same way. I'm just going to go through and see if there are any questions. It looks like we have some Fall Prevention Task Force members in the audience, which is wonderful. And then let's see, have a question about the slides. So the slides themselves will not be available on the email, but we will send out a link that has the whole presentation through YouTube. So I will send that out to everybody who has been on this list so that you can watch that again. We will also include some of the blogs that Dr. Bell was referring to in her presentation, speaking about specific topics that we covered today. So hopefully those tools will be helpful and it will provide more information for you. If you do have any other questions, please submit them now, and we can help you answer those while we're here. And I know Dr. Kim Bell has her website up here as well, betterbalanceandlife.com. So as you've heard today, she has a lot of expertise and great resources that I think you would be able to benefit from if you did check that out.
Can I ask where do I get those lectures on fall prevention and vertigo analysis?
Sure. So for the different lectures would be through UCSD, the Stein Institute, correct?
Right. So the lectures that we discussed for the Stein public lecture series, you can go to UCTV and then type in my name. They actually have it under my full name, which is Kimberly Bell, Kimberley. Or I have them linked on my website, so perhaps a more efficient way to find them would be to go to my website, betterbalanceandlife.com, and then click on the About drop-down menu, and then click on the press page. You can also search in my search feature for the word press, and it'll take you to the press page, which are just different times I've had an opportunity to be in the media. And when you find the press page on betterbalanceandlife.com, I have those lectures linked there, so you can find them that way, or you can find them on the UCTV website by searching my full name, Kimberly, with an L-E-Y at the end, Bell.
All right, great. And then, so thank you again so much for your time and your expertise. I think we've all learned a lot today. And for those of you who are listening on behalf of somebody else who you know is dealing with any of these symptoms, please share the information with them, because that's the whole purpose, is to make sure that those individuals are getting the information and understanding how to manage the symptoms and what resources are available to help them through that process. I do also want to put your attention on an upcoming event that will be taking place. So September is Fall Prevention Awareness Month. In San Diego, we are working with the Fall Prevention Task Force for Central San Diego as well as North County to host Fall Prevention Awareness Day events. So I have included a flyer, which I'll include in the presentation, in the email follow-up as well, so that you have the details if you are interested or you know of somebody that might be interested in attending this event. The one in particular that's posted here is at San Diego Oasis on Monday, September 23rd. There will be another event that is pretty much very similar to this that is taking place the same day and same time in San Marcos. So it will be covering those two areas of the county. And this is ElderHelp's general information. If you have general inquiries about our services, please feel free to call us or email us. If you would like to be notified of the upcoming webinars that we have, again, these started out through our Employed Family Caregiver Support Program. We do open them up to the public, even if somebody is not a family caregiver, because the information can be so helpful. But if you want to be notified automatically of the upcoming webinars, feel free to email me directly, and my email address is there. And that way you don't have to notify me each time. You would just automatically get the information. And of course, if you are interested in looking at this webinar later and maybe you misplaced the email when I send you the link, all of our webinars are kept in our library on our website, elderhelpofsandiego.org. Under the Family Caregiver page, you will see webinars and all of the past webinars that we have had. So you'll find that this webinar today up a little bit later this afternoon. And again, I will send out the link to everybody afterwards. So thank you again so much for joining us. Do you have any?
Yeah, thank you. I just want to thank you all for your time and attention, and I hope this was helpful. And as Carrie mentioned, please pass along this information, because when people have dizziness or vertigo, they go from being fine to being totally desperate to find answers and get help just instantaneously. And it is really debilitating for people. So thank you for being ambassadors of this information and passing this along. I really appreciate it.
Thank you so much again for being here, and have a great day, everybody.